Hey there, Dr. Richard Alm. In this video, I want to talk to you about, what is DNS, or what's actually called Dynamic Neuromuscular Stabilization. Now, to me, this is the most progressive, most advanced form of rehab that I've ever come across anywhere on the planet. And it's actually something that each of the docs in this office not only use with each and every one of their patients, but are actually certified in. So we've had to go through extensive coursework to get certified in this powerful approach. Now, what DNS is essentially an explanation of movement and function that is based on developmental kinesiology, which is the neurological and physiological aspects of the developing child. Now, this is a time where we sort of learn to move and stabilize the way that we're supposed to, and the main goal of DNS is to actually restore that. Another way to look at it is DNS is essentially describing, defining, and explaining the way that we have evolved to move. And if we can move in this optimal way that has sort of made it through millions of years of evolution, then that's going to allow us to move in a way that reduces the load on the tissues and maximizes performance. So in the process of doing DNS, every patient that we're looking at, we're sort of looking at through the lens of DNS to see how well is that patient moving on a functional level or an evolutionary level to make sure that that shoulder is moving the way that it's supposed to with the right muscle balance, with the right timing, so that we can minimize load on the tissues. Essentially what it does, it just maximizes and optimizes the quality of the movements that our patients are moving with, and that has a humongous implication not only on their pain, but on also addressing a lot of times the underlying cause behind that pain. So in the assessment, we're essentially going through and we're using several different movements to assess the quality of our patient's stabilizing strategy, the muscle synergy, and the overall movement. And then we're going to be using some exercises based in that developmental kinesiology. These are movements that are milestones in development, like, it might be side lying, it might be a squat, it might be crawling. These are ways that we can actually restore this optimal movement in the patients and athletes with which we work to help them not only perform better, but also get them out of pain.